Hello, and thank you for joining us. I'm Sandy Potter, alongside Masonicare President and CEO, JP Venoit, and Dr. Ronald Schwartz, our Senior Director for Continuum Health Services. We're checking in with you once again as we all work together to help prevent the spread of coronavirus. Dr. Schwartz, it's great to have you back this week.
Thank you.
Yes, we're excited to have you again. And we wanted to ask you, as more and more people receive the vaccine, there have been questions as to whether vaccinated individuals can still spread the virus and whether or not they need to continue to wear masks. Can you give us your best advice?
Sure, Sandy. Let me just say first, thank you for welcoming me back. I had a nice week off. It was usually you'd call it a vacation. I guess now you call it a staycation. I never heard that term so much until COVID came around, but I guess what you do in a staycation is you stay home and you take care of all the errands that you normally wouldn't take care of if you were working. And one thing that I did take care of is I got my second shingles shot last week. So I started to think to myself, since October of last year, I got a flu shot, 2 COVID shots, and 2 shingles shots. So if I can say nothing else, at least I practice what I preach. So having said all that, let's talk about how we're doing in general as far as vaccinations. And, I almost any data that you look at, they can have a little bit of variation, but I did collect some data that I saw just in general about United States and how we're moving along. And we're actually vaccinating a rate of about 2.1 million doses of COVID vaccine per day in the United States. So around now, and again, it may have changed a little bit, but there are about 59 million people that got the first dose, or at least the first dose, and 31 million that are totally vaccinated. That's like 10% of the population. So we're moving along very well, but I think what we also need to realize is 90% of the population still needs to be vaccinated, and we still need to be diligent with this regard. And there's always this phenomenon of asymptomatic transmission. And the CDC does certain studies and they do certain predictive models, and they actually have found as much as 59% of COVID can be transmitted by asymptomatic carriers. So this is something to be very aware of. And when the vaccines did their trials, like Moderna, Pfizer, and Johnson & Johnson, they were more looking at, sick people, more moderate to severe diseases, trying to prevent hospitalizations and certainly preventing death. And we know how well these vaccines had worked in that regard, but they didn't really have time to fully study asymptomatic carriers and how these vaccines worked on asymptomatic carriers. And it's still possible that people can harbor the virus even after you've been vaccinated and still spread it to others. So maybe for a minute, we'll talk a little bit about how asymptomatic transmission happens and what that really means. So for most upper respiratory infections like the flu, and particularly COVID, the portal of entry is really the nose. So what you want to think about is the nose is like your front door, and the virus comes in your front door and your nose, and it kind of stays in your nose, and you make antibodies, and these antibodies, once you're re-challenged with the virus, are really right there in your nose, and they're ready to attack. When you talk about vaccines, it's a little bit different process where you get an injection intramuscularly, and then you build up antibodies, and we talked about this before, to the spike protein. And it's very likely, and I'm sure it does happen, that these antibodies travel through the bloodstream and come to your nose. But what they don't know is how much of these antibodies come to the nose and how quickly they come. So it's certainly possible that these, people that have been vaccinated can still have the virus harboring, in your nasal passages. And if you're not wearing a mask and you sneeze or cough or you're speaking, to someone, you could spread this, this virus, and particularly to people that haven't been vaccinated yet. So you want to think of a mask almost like a screen door and the nose like the front door. And that's how you prevent intruders from coming in. So that's kind of my analogy to this. But, I think the take-home message is there's no question, and we see this in our day-to-day lives, that the vaccines are doing excellent effects in what we still need to study is and is being studied is the effects on asymptomatic carriers. And I think until more of that data comes out, we still need to reinforce the principles of wearing your mask, social distancing, washing your hands, avoiding large gatherings, still avoiding travel, and most important of all, getting vaccinated. So now comes my inspirational quote for the week. And it says, when you find yourself at the end of a rope, tie a knot in it and hang on. And I'm not sure actually who said that. When I Googled it, it came back as some said Franklin Delano Roosevelt said it, and some said Theodore Roosevelt said it. Maybe they both said it, I don't know. But I guess the real point is it seemed appropriate in that this has been going on for all of us for more than a year. And a lot of us do feel like we're at the end of our rope and we're getting tired of following all these practices, but we're really, really making progress. You can see it, whatever I say every day, and we just have to continue to be diligent. So again, I want to thank everybody for everything they're doing, all their hard work and dedication, and once again, wish you health and peace. Thank you.
Thank you so much, Dr. Schwartz. And we were joking with you before, but we didn't attempt a quote in last week's COVID update video because you are the master of finding the perfect quote for every week that we do this and every moment that we've all been going through this together. So thank you for that. And JP, this week the governor made some big announcements that there is now an accelerated schedule of vaccine eligibility in Connecticut, and also that we will be seeing the easing of many COVID restrictions across the state. But these things should not be taken as indicators that the virus has run its course by any means. Of course, Dr. Schwartz was alluding to that as well.
Well, interestingly enough, Dr. Schwartz talked about, in his quote, a rope. Well, I would tell you the vaccine is a rope to lead to more hope. And when we talk about the governor really taking those restrictions and changing them to be, I would say, less stringent is probably the best terminology. However, I would tell you, we as an organization here at Masonicare are still going to continue to be stringent on how we do our business for our residents, patients, and clients. And that's really because at the end of the day, this virus is not leaving anytime soon. The vaccine's great, that rope of hope to really eradicate the virus is going to take a long time. And even though restrictions have been loosened, Masonicare is still looking at ways in which we can continue to combat this terrible virus through really some restrictions that we'll still keep in place. We are slowly opening. We are opening slower than maybe some people would like us to, but that's really because we want to make sure we don't have to shut down very quickly thereafter if we see an uptick. And in the state of Connecticut, we are seeing some great movement in the reduction in cases, the increase in vaccinations. I believe a little more than 30% of individuals over the age of 16 have already gotten their vaccine, at least their first dose. So that's very good news. But at the end of the day, mass social distancing and really still avoiding large crowds is extremely important. The only way we're going to be able to fully combat and conquer this virus is through us all working together. And if we can all work together, we've got a better chance at getting back to some normalcy. So that rope that's hopefully pulling us through that tunnel to that light of hope really can be accomplished if we still do some of the basic things that have been talked about: washing hands, masks, distancing, groups. All of those we've talked about almost at every single video since we've started this. That should not change. Now, I'm happy to say we've started the visitations with in our nursing home, and they are absolutely going fantastic. We are so happy on how they're going. And the smiles and the hugs that you're seeing, and yes, they are able to touch each other per the CDC. It is absolutely fantastic to see. But we still have to worry about the virus coming into our campuses. So even though it's another step to that normalcy, we're still watching and making sure it's really being done in a very safe manner. And I would like to thank the staff and the leadership of Masonicare for everything that they are doing, because they have been fighting this thing for well over a year now. We are actually very close. Actually, on Monday, next Monday, will be our 1-year anniversary of our first cases that we received. So it is extremely important for us to continue the fight, continue for us to be vigilant. Dr. Schwartz, welcome back. We missed you. We missed your quote. And I will tell you, you were very much missed in our task force as we continued the fight of the virus. So thank you, Sandy, and thank you, Dr. Schwartz, for being part of this really battle that we're fighting forward.
Well, thank you both so much for sharing your time and all of this important information with us, as always. And thank you for watching at home. Until we see you next, we hope you'll stay safe and stay well.